It's Diane Massage Mentor, the teacher after the techniques, and I am so excited because I have Judith Aston with me, and I mean, the more research I did on Judith, the more impressed I was. I was just saying, like, everything you're doing is so thoughtful and amazing, and you've been around for 50 years. And hello, Judith.
Hello, Diane.
This is so exciting. And I was telling Judith, every time I see her, like I've been watching some of her videos, I'm like waiting for her not to be sitting perfectly and stuff. And I couldn't find too many flaws. I couldn't find her going, or I bet you there's got to be a time, but I just couldn't catch her.
I'm going to start off by telling you something, and that is that I think one of the things that happens is once some of these ideas connect with what feels true for someone, it's automatic.
Yes.
And I had a friend that had a baby. You might have read this story, but quickly, her 3-month-old baby, and I said, listen, I'll bring lunch and we'll visit. And she said, I will watch you eat. And I said, what are you saying? She said, the baby cries every time I put him in the infant seat. I said, oh. So I get there and I said, can I see what happens when he's in the infant seat? She said, you really don't believe me, do you? And I said, let me just see. She puts his little butt on the thing and he starts going, and he just starts screaming. And so she takes him out. And I said, would you do me the honor of just giving him a little bit of arcing and so on, and then putting him back in the infant seat? And she did one of those things that women do that have babies with people that don't have babies, telling them what to do. She gave me one of those looks of rolling the eyes. And I said, humor me just for a moment. So I did the arcing and so on with the baby's spine. And I modified the seat so that he wasn't sitting on his low back, but he was sitting on his pelvis. And I put his little bottom down and I rolled him back into the seat. And he goes, Papa, and he's turning on his axis. And she leans forward and says, what did you do? I said, babies recognize neutral. I didn't have to teach him. I didn't have to convince him, nothing. I said, can we do the other just so you can see? She said, no, don't touch it. So I think it's like that, Diane.
And I think, it's just like, I love what you said about when you find something that works for you, it just becomes who you are. As I'm sitting here, I'm like, oh yeah, I'm sitting on my pelvis. Now I'm always going to be thinking of you as I sit on my pelvis. So, and two, let's just say one, I just want to throw out one thing, is that you were the first female class president in your school.
Yes, and you wrote that as a question, and I thought, oh, I remembered. I was 11 years old, and I remembered that my slogan was, all I'm asking is vote for Aston.
All right. I mean, great things were ahead. Great things were ahead. And so you've gotten to work with, the list of people you've gotten to work with is a little too extensive. But I got a little teary, just like, oh my gosh, this woman has been, since college, just talking about movement. So I think just so everyone understands, and correct me if I'm wrong, but to a degree, you're a bit of a movement expert. And you've gotten to work with an extensive, like I said, list of people. And could you just tell us a little bit about maybe who's influenced you the most?
Well, the most would be my high school teacher, Marty Walker. And she was the teacher for all the blind students. And so one class period a day, I assisted her for 3 years when I was in high school. And she taught me many things. And one day when I was a junior, she said, what are you wanting to do with your life? What is your career? And no one had asked me that. And I said, well, probably I want to be a flight attendant. And she said, what? She said, why? And I said, because I want to travel around the world. She said, you can do that anytime. She said, born to teach and your skills and your aptitudes are math. Why don't you go into engineering? And I said, just to show you the times in late 1950s, I said, you mean there are lady engineers? And she said, go for it, girl.
That is so amazing. That's so cool.
And it was cool, and she was a lifelong friend. She died about 10 years ago, but oh my goodness. She said, you were born to teach, and I was teaching dance and movement in the high school and in charge of the pepsters at the football games and blah, blah, blah. Anyway, yeah, movement has been my thing. Then I had 2 serious car accidents, and the psychiatrist that had me develop a movement program for his patients, said, well, I've heard of a white witch by the name of Ida Roll, and she's going to be in Big Sur, and you should go see her. She does da-da-da-da-da. And I said, I'm on my way, literally almost on my way. I called friends at Esalen and said, I'm coming. And they said, well, she's booked. And I said, no, I'm coming anyway. So I sat on the girl's doorstep for about 2 days.
I love that.
And she opened the door, and finally she said, what are you doing here? And I turned to the right and said, Dr. Rolfe, I'm waiting for a cancellation. And so I just sat there, and then I guess the next day she opened the door and said, I have a cancellation at 2:00 tomorrow, come, close the door. So I got into my first session with her, and it hurt. The girl really knew how to use her knuckles and elbows, and I'm a wuss when it comes to pain, and so I was aware of that, but as soon as she stopped, I could feel a difference. So I was aware immediately that I had more range and I felt more resilient and so on and so forth. And then she must have done some research about this weird woman sitting on her doorstep for 2 days. And she said, I understand you design movement programs for people. And I said, yes, I do. And I started to go on about my history so that it would be like my CV. She said, no. I wonder if you design a movement program for my work, structural integration. And I said, sure. And then the story goes that I was supposed to go to Europe. She said, no, I have to train you. It starts in 6 weeks. I said, I can't. I already have my plans. First time to Europe. And she said, change them. And she said it in such a way that only Ida could say, with a look of a triple Taurus. She said, change them. And I said, okay, I will. So that was the beginning. And
can you just do one thing? Can I interrupt? Could you just do one thing? Just because I sit here and I look at you and I'm like, oh my God, one, I already told you, gorgeous, right? And then I hope that's not inappropriate. Sorry about that.
No.
But, so two, like what year was that?
That was 1968, April.
So amazing. So cool.
So, and then when I did the auditing class, because I had taught my acting students at the college that I taught how to see bodies, because if they didn't know what they were doing with their body, they were hysterically funny when they would put on something serious or someone enraged. They would just be in a certain posture trying to portray love and confidence in a posture like this, and you go, it doesn't really work. So I had to do that. And so the Rolfers that were training started moving to the back of the room because I was trying, you know this, Rolf, I was trying to be obscure and not obvious so that I wouldn't be selected to go to the front of the room, right? So I'm looking very involved and someone in the back of the room, and they'd come and hang out with me and say, Judith, what do you see? What do you see? And I'd say, well, there's a tilt low on the left shoulder and also on the left hip, so that's significant. They'd walk to the front of the room, they'd say, well, I see tilts, da-da-da-da-da-da, whatever. And I would say, oh, that's very good, but you should know what muscles those are. And so then they had to sophisticate their answers because I don't do things by muscles. In fact, there was a very comical moment in class one time. She said, Judith, I think it's it could have been the piriformis. And I went down to the peroneals. Anyway, she said, it's not down there. Learn your muscles. I said, okay, Ida. But Somehow I memorized them all for all my tests, but I don't work by muscles. But anyway, Ida changed my life. This is what's interesting, and I say this to anyone listening that's only in movement. I never thought when she said, I'll train you, that I would have any aptitude for body work. It turns out that all the things that allow me to see bodies in motion work for me, doing the work, watching the tissue, feeling the tissue. It was such a gift to me that she introduced me to this opportunity, and I have really run with it. And just secondly, one of the honors of my life was one day in class, the guys were doing sessions. I think I was the only woman in that class, yeah. And I'm sitting in a chair next to Ida, and I'll be Ida for a second, and she goes like this with her hand on the chair. And I looked at it and I went, maybe she just wants to rest her. I don't know what she's doing, but I'm going to pretend I'm just focused. And so she said, work on it. And I said, me? Okay, sure. So I worked on it, and then pretty soon came the other hand, and then pretty soon she asked me if I would give her a session. And I didn't have the opportunity because we weren't in the same states very long, but still, it was really an honor. I got to work with her several times, and I knew she only had Dick at the time, her son, work on her. So it was such an honor, and she gave me so many gifts, and our time together as being her Girl Friday was so special. It was so special. I loved it so much. And then Moshe came, Ida, I was involved with Dr. Rolf from 1968 with the trainings, assisting and developing the movement program for her work until 1977. In 1972, Moshe Feldenkrais, the third person I wanted to talk about, he came to Big Sur. It was really interesting because those two evidently had a friendship and a little annoyance with each other somehow, and they were both teaching at South, whatever it was called, Big Sur Motel. She was in that end. I would run down on lunch breaks and visit my friends, and I would come back to class with Moshe at this end. They would say things. In fact, I gave him a message or something. He paused. He said, "Wait a minute. They're down there doing structural integration." I said, "Yes." He said, "Then this work is called functional integration." And I said, "Well, there you are there." And that has been one of the titles that people have used for Moshe's work. Anyway, so he asked me, "Why are you here?" And I said, "Oh, Moshe, you are a genius in the movement world, and I'm so honored to be able to be in this class, not because I came to train with you." I said, but because of your genius and your being a physicist and your understanding of the fundamentals of movement, I've been discovering so many ideas, and I wanted to know if you would be willing to watch me work and tell me why it works. What's the cognitive part of this that I probably don't know and have to study why it works? So he said, okay, Friday afternoon after class, I'll watch you do a session. So I got someone to be the client. Moshe used to smoke a lot, and he smoked during class, and he was way on the other side of the room when I started my session with the person lying on the table here. And I'd notice he kept getting closer, and he kept getting closer, and he kept getting closer. I was rather concerned because I was afraid his ashes were going to fall on my client, because eventually he ended up like this, right over the client, right? So the client leaves, and we get the conclusion of the client, and the client leaves. And he says, this was his, "Did you figure this out yourself?" And I gave one of those answers where, as a child, when you want to say yes, but you're not quite sure whether you're supposed to. I said, "Yes," like that. And he goes, "Very good, very clever." And he got up and walked out.
Oh, that's awesome. How cool is that?
However, he never explained the why, but he started sending me a lot of people for sessions. So it was one of those, I did see him in 1980 in London. I stopped to visit him while he was reading a book. I love that person also. So those would be three people, Marty and Ida P. and Moshe.
And I mean, that's a very nice bunch. Very nice bunch. It's amazing. Amazing. And then through all this, I mean, since it's like a natural gift for you. It's just movement and watching people and seeing what's going on is a natural gift. Such a natural gift and so thoughtful that you've created the Aston Aston Kinetics. So could you just tell us a little bit in your own words what that means? It's like art. It's so beautiful.
Thank you so much. You know, it is math and art. Yeah, you're right. And those are the two arenas that attract me, actually. The first thing was the first thing that I was drawn to that gave me great stress was the sky hook. That one should aim to lengthen oneself by pulling the top of the head or pushing it, no, not pushing, pulling the top of the head up, lengthening the back. I think Dr. Rolfe might have been influenced by Alexander's work when she was in England. But a lot of people taught that. In dance, I was taught that you always reach up to be very long and very statuesque. And I became, because I'm very observant and always watching what's going on, I noticed that at the end of the sessions, as I would give them cues that Dr. Rolfe had given us, the feet straight ahead, the knees soft, elbows out. I don't even know, you're too young to know all of this other stuff. But anyway, waistline back, feet straight ahead, elbows out, waistline back, chest up, chin in, top of the head up, elbows go out when the psoas takes over with the walk, and so on and so forth. And I would watch this and I would say, I don't know what to do, because they stood, they looked graceful, they looked authentic, they looked eased. And then I give them this cue and they go on hold, and then I ask them to move while holding the good posture. What am I doing? This doesn't make sense. So I started playing with this idea of, instead of reaching up, what about pushing off the ground? So you get your length by the push. And therefore, gravity takes us from the top down all the way to the feet. So gravity just cycles down like that. And pushing off with the feet cycles upward until you find that moment of suspension, like the top of an elevator floor. And then you settle down into gravity phase. So I started playing with this, with teaching the Rolfers how to push off their feet in certain designs to support the work they were doing with their bodies, and so on and so forth. And then one day, oh, this is wonderful, in the late 80s, Darlene Hertling, a physical therapist who wrote kind of the Bible for physical therapy, Darlene Hertling, was taking trainings with me in Seattle. And she came up to me, she was so sweet. She said, you know, Judith, I knew I was in trouble. You know, Judith, because it's kind of this, you speak to a young child this way. That thing you call the push-up does have a technical name. And I said, it does? What is it? And she said, it's called ground reaction force. And I said, oh, thank you so much. I couldn't believe it. And so I started reading about ground reaction force. And what I realized is people know about it, but they don't know how to recycle it to keep it going. Instead of just one push, you may need many for the different vectors you're doing in your sport, or your body work, or your singing, or whatever. It's not one push per breath in singing. Anyway, and so I went wild with it. And then I noticed, do you have room to stand
Yeah.
where you are, Diane? So go ahead and stand.
Oh boy. Oh boy.
Oh, what happened?
Oh, I'm just nervous.
Oh, no. I just want you to feel something. So bring your feet fairly close together and straight. And do that pattern, waistline back, elbows out, chin in, and so on and so forth. Although I know this is no longer current. A lot of the Rolfers that I teach, they laugh when I show this. But anyway, so feel that. And now reach up with the top of your head and feel that. And feel where the weight is on your feet. And generally it's toward the heels.
Yeah.
Okay? Now, let your heels stay where they are, but let the ball of the foot open, a few degrees, 5. And feel how that pitches you forward on the whole foot.
It sure does.
So there you are, just standing in a very good posture. And what I've discovered, and I finally had a chance to write about it in this new book that it's almost out, is that this position supports the width of the body with the ball of the foot to the heel, which catches the midline from the ischial tuberosities up. And so here is a really solid base. Now, this will change depending. Now put your feet back again and feel what happens.
Mm-hmm.
Yeah.
I love that, especially because can I go off on that a little bit?
Please.
Just because for me with body work, everyone's like, how have you made it for all these years? And I mean, I can imagine with some training from you how it would have been even more joyful 24 years, because of the thoughtfulness that goes into your work. But body workers, one of the main things I think that happens to them is they just are not using their bodies like they should. And
yeah, exactly. And so what happens is that, for example, one of the things you asked me to talk about, the shoe modification.
I was like, oh my gosh. I'm sorry, Judith. It's so cool.
But what happens is that many times it isn't just even that move where you're going to have the person on their side and you're coming to work the psoas area and so on and so forth, right? It's not even that. It's when you put your hands on the body symmetrically timed, you put your body on hold. If you lean and push off and touch the right hand, lean and push off the left and settle, suddenly you've got the movement going through your body. You anchor yourself into this, and then you have the effort, and you go, I don't know how many more years I'm going to be able to do this.
Oh my God, I love it. This is it's so true. It's so true. As you're doing all this stuff, I feel it.
I'm so glad.
It's very cool.
This is what I love, though. This is what I love, because people would say, well, how do you know that? I mean, I was almost booed off a stage by Martin Marietta invited me to come in Denver to visit. I think they were interested in maybe some of my products. And they had a humans factors meeting of designers somewhere in Denver at the same time. And they asked me if I would participate and just share a little bit of my discoveries. And a woman from Germany stood up and said, how dare you say this? You have no research and you have no reason that you should be telling us these lies. It was like, oh goodness, I'm glad she didn't throw anything. But the point was that I was sharing only my discoveries, So the piece now that it's so fun to see you play with these ideas, because it isn't about, I have to sell you. You say, wait a minute, I felt the difference. Give me an application to use that in 10 other ways, kind of thing. But yeah.
So, I mean, all right. So I'm just going to run with this part because I think it's really important, and because we have massage therapists on the site that I think would really benefit from taking some of your classes. I mean, I can see how it would help a body worker, and you just gave a couple of examples. But do you want to just, give us a little bit more on how Aston Kinetics can help a body worker, not just with helping others with movement, but helping themselves last in the industry?
Well, it depends on which part of the content that people want to study. Because I find that, I've trained psychologists, psychiatrists, MDs, people that work with senior fitness. The more you know how to see the body, you have a reference for being able to identify and help people understand what's current so they can be the judge of what is not. And sometimes it changes so beautifully and easily. And the next time the person goes in and they give you their whole interest that day, and you say, you haven't mentioned how your broken leg is doing. And they say, oh yeah, no, it's fine. Yeah, that would be a good one for you to mention, because the fact that we not only worked with it, but we changed your shoe modification to allow you to have the hip be more swinging, more neutral, might be contributing to that. Meaning, when you can see bodies, you see the expression, you see the meaning that is intentional, which isn't always what is expressed. But the piece there, meaning that there are people that will be in loss and despair for someone they love having died, but they don't want to talk about it, and they're saying they're just fine and everything's good. You see this discrepancy. So, for example, if that client came into me, I wouldn't say, you need to have your chest full because it's better for your posture. I would do certain exercises to have them take through full range of motion. And where, if you're honoring, right now, this is your neutral, and you're honoring, right now you happen to think of so-and-so, where would you settle in to allow the grief to feel matched? And most times, it's here and not where it is when they came in, because they had an experience of change that they could select. So massage therapists can look at people. Many of our therapists we train work at spas, particularly in Hawaii, they work at spas. They don't have, we teach them subtle little ways of greeting the client in the waiting room and watching them walk. Oh, you walk ahead of me, it's number 5, and they're watching the body. So they could get a little bit about how they use their body. But on the table, you can begin to see, gee, the legs are to the right of the chest and the upper body. There's some kind of something going on there. Seeing is number 1, I think. Body usage is probably number 2. How do I pick this up in a way, like this person's leg, that works for my body and works for them? So same thing as I told you before about the asymmetrical timing of touch. If I go to lift a leg and I want to have one hand under the medial Achilles and the other hand under the knee on the lateral, and I'm going to flex it. If I touch the leg at the same time and lift it up, I put them onto my holding pattern. And I tease the students. I say, this is a good gig if you can get it. You put your holding pattern in there and they pay you to get it out. Very clever, right? So, but if I do the Achilles, use my left foot for my left hand, I back up and I push GRF, I can see their true range, and they are not held at the medial portion of those adductors. They are not held. That was me. So when people learn how to use their body, it's such a gift because it keeps giving after work. And I think that's the only reason I've been teaching for 56 years, actually, probably is about this body use thing. The other thing is I started in probably 75, 76, because of my interest in observing bodies, I started noticing that the work that we had done with people seemed to go from superficial toward deep, but it seemed as though people were held at the osseous, at the skeletal borders. I didn't see it go through to the other side of the body, the movement. Or when I would press, I didn't feel it roll through the femur to the other side and out into the bed. I only felt, so I was curious what that is about how skeletal patterns and the holding patterns right at that interosseous, but also the attachments. And so I created this work called arthrokinetics, which is movement of the joints, and then it started to be tissue that acts like bone, meaning scar tissue, other tissue. And then I started to create a movement program for that people would learn how to do that themselves. So creativity has been my strong suit in this lifetime, and it's one of my problems. Because I find that if a friend is in trouble or a client is in trouble, that I can be thinking about something they said for 6 months, and I'll sit up at 3 a.m. in the morning going, that's it. I never thought of, I give them a call, come back in. Sometimes they've moved away. But the point is that I didn't realize that I have such a wealth of filing system for things that have been bubbling for decades, actually. And so then I create something new and it gets expressed, and then I'm on to the next thing. But there are so many forms of body work that we teach people: a massage form, we teach them a soft tissue form, we teach them the arthrokinetics form, we teach them how to get from superficial to deep by how to use the hypertone and hypotone, hyper and hypo toned layers along with the skeleton and body usage to get all the way down to that attachment to the bone without pain. It isn't that Ida didn't try to get to a lot of places on me with her strength. And I remember one time she decided to demonstrate the psoas move on me in a class in Florida or something. No, it was probably Big Sur. Anyway, and she's kneeling in front of me going in, like this. And I'm leaning forward and she said, come on, what can a little old grandmother do to you? And I said, hurt, like that. She said, come on. And I did. And it was really something. I would then say, if Ida ever asked me in this year in my life, I would say, there's a way of wavering in. It was slight asymmetry, or you keep going deeper. Some people feel it like a melting. Some people feel it as an opening, but it's the motion and the sensitivity in the fingers that allow you to get there. So anyway, there are many, many things that we teach in terms of body work. And then there's many things in movement. Then we teach Pilates and yoga, and I create a lot of classes. People will,
cool.
I would just create classes for senior fitness. And, one of the questions you asked me is, what is that moment in a session where it makes it all worthwhile? In a way, I'm paraphrasing what you said, but it's always the same moment. It's the moment when the client or the student has an aha, and it's life-changing. You know that something just happened in that moment, or that suddenly often happens with tears, and they say, I had lost hope. And I think all of us in this field have this experience, and it's the thing that catches you in a surprise every time because it's so genuine, and I love it so much. So I train dentists how to use, I want to give you one for your readers. I want more people than me to be obnoxious at the dentist. So I was at the dentist recently, last year. I was also recently, but last year I was there, and he said, yeah, let's check your bite. I have a feeling that discomfort you're feeling is your bite. And so I said, you want me to do it in this chair, right? He looked at me like, of course. I said, okay, let's do that. I said, but only if you'll use a different colored tape and let me stand and do it again. And he goes, okay. So you lie back, your head is touching.
Right.
Your head is stabilized, so you're opening your jaw from there. you close it, and I said, okay. He goes, oh, I was hoping you forgot. I said, no, I'm standing up. I don't want the blue or the red or whichever one you didn't use. I said, now I'm just standing, kind of like I would be sitting, eating and chomping my food, right? And he said, okay, it doesn't make any difference. I said, please. He says, okay. So he does it, and he looks in my mouth, and he goes, I would never, ever have believed this to be true. I said, it's totally different. I don't want you to grind my teeth. I don't eat my meals lying back with my head that way, please. But when I saw him recently, he did the same thing, and I said, do you remember? And he goes, oh, that's right, you're the patient. And I said, yeah, well, you might want to do this with other people because, so anyway, there's just so much that the people that train with us learn, and some people are lifers. Every few years they take a class, but it's just so much fun. It also expands on its own.
And so on that, just because I want to watch time, I'm going to beg you to talk to me again. Do you have any words of wisdom that you kind of want to leave us with?
Yes. Well, there's always a way. There's always a way. So, for example, these days, hip replacements are happening more and more. I mean, more to the front, of course, but with the result of more internal rotation. Okay? Which means that if you look at the anatomy of the skeleton, I could bring it over here, but the point is, we know the shape there of how the femur comes into the socket, right? It's a diagonal from more central to more peripheral. So the position is often more internally rotated, yet the design of the bone and so on was going to be this way. So people come out of the surgeries, we work with them, and they're in a lot of pain when they start to walk. And they are walking straight ahead, which is squeezing the joint, the adductors, all of the tissues that are coming into that. And I say, well, you don't have to turn out very much, but you could simply lean your body and step wider when you step on that hip replacement leg, and then forward and wider. And they'd say, that doesn't hurt. It doesn't hurt. And I'd say, oh, I'm so glad we found, it may be a slightly different pathway for a different person, but there's always a way to figure out something that's better. And so many people say, I've done for you what I can, that's it. And you walk away going, I guess I'm hopeless. No, there's always a way. There's always someone that can begin to play with the math and problem solve. And I say, go for it.
I mean, I don't even know what to say. Judith, you've covered so many beautiful things from the movement, which is something I think body workers could never know enough about and never watch enough and never explore enough. And just the thoughtfulness that has gone in throughout your life of coming up with all these incredible answers and ideas on ways to help people. It's amazing. And I love the way you talked about touch and getting in deeper without, there's so many treasures that you're sharing with people. And I can't say enough about it. It's like all the gems are there and being shown by you. So I just want to thank you so much for the last 50 years of your hard work and commitment to the industry and to movement and to the human body and the beauty of it. I'm in awe of you, actually. And you've left me rather speechless, which doesn't happen very often. I mean, I don't even know what to say. I just know that I want to talk to you again. So I'm gonna say thank you, Judith, so much for your time. I'm gonna sign off. If you would just hang tight with me after I end the session with the group. But everyone, you got to check out Judith. I mean,
thank you so much. Thank you so much.
Her website is below. You have to go to the website. You have to watch the videos. If you're into massage and body work, this is just a whole new level of those things, the movement and everything. everything. So thank you so much, Judith. Everybody check her out because she's amazing.
Thank you, Diane.